Hi, this is Chee-Wee here. Now in this video, we will be looking at sitting postures. These are the learning outcomes for this video. By the end of this video, you should be able to discuss and apply biomechanical theory to different sitting positions, discuss the postural implications for these different positions, identify potential problems with them, problem solve each seating scenario, and also to provide advice with reference to optimal sitting postures. There are some advantages of sitting over standing, and one of this is that the body weight is distributed over a larger area. This means that our body is in a more stable position. This also helps to decrease our energy consumption, thus having far fewer demands on our cardiovascular system. So what is the biomechanical explanation of how we sit and how do we get there? One way to explain the position of sitting is by looking at the ranges of the joints involved in sitting. This means that a hip is in 50 to 60 degrees of flexion, and there is about 30 to 40 degrees of posterior rotation of the pelvis as well. This allows the pelvis to rest in a more comfortable position, usually with the body weight resting on our ischial tuberosities. This figure compares the angulation of the pelvis between a standing position and a sitting position. As you can see, the pelvis is rotated posteriorly, and this pelvic rotation flattens the lumbar lordosis. As a result, there is uneven pressure on the intervertebral discs in the lumbar region. In sitting, as a result of the pelvic rotation, some other additional biomechanical changes also occur. The superior surface of the sacrum, which was previously facing anteriorly, is now facing upwards. As a result of all the changes in the lumbar curvature, sacrum orientation, pelvic rotation, and pressure in the intervertebral discs, the muscle activity of the back, upper and lower limb also alters as well. We will see this in the next few slides on the different types of sitting positions. The first sitting position we'll be looking at is the upright unsupported sitting. In this position, the person sits on a chair or surface with the back unsupported. In this position, there is increased activity in the spinal muscles to maintain the upright posture. And there is activity in the trapezius to also hold the trunk straight by pulling back the shoulders. The iliopsoas, which is a hip flexor, is also working to prevent the trunk from falling backwards. Within the intervertebral discs, the pressures are about 35% more than that for standing. The next position we'll be looking at is the relaxed, unsupported sitting. This is most likely the position we'll be adopting when we sit on a surface with no backrest. Although this is more comfortable compared to the upright, unsupported sitting, there are some issues with this sitting posture. Firstly, the reason why this is more relaxing is because there is decreased muscle activity in the back. With this increased back curvature, there is anterior deformation of the intervertebral discs. This means that the disc pressure is increased compared to upright unsupported sitting. With the concave curvature of the anterior abdominal area, there is also compression of the abdominal and thoracic organs, for example, your stomach, your intestines, and your lungs. This may mean that there is impaired respiratory movements and also increased activity in the posterior neck muscles to hold the head upright. The last sitting position we'll be looking at is the anteriorly inclined sitting. This sitting position is very similar to the relaxed, unsupported sitting. The difference is that the person is leaning forward, thereby increasing the amount of hip flexion. The body reacts to this position by increasing the back muscle activity to counterbalance the weight of the trunk leaning forwards and the weight of the arms. With the more anterior leaning posture, this also means that the anterior pressure in the intervertebral discs is also increased. So now that we have considered the sitting position and learned about some of the issues with them, what can we do to improve the situation? There are some very simple things that can be done to correct the postures. Firstly, the use of a backrest will greatly improve the situation. The backrest acts as a support for the trunk to rest so as to decrease the muscle activity in the back. With the back posture more upright, this means that the intervertebral disc pressure is also decreased. Also, the pressure on the abdominal area is decreased as well, thus improving the respiratory movements. When we do want to implement a backrest, there are some features that will help with improving the sitting position. Firstly, the inclination of the backrest should be about 110 to 120 degrees to the horizontal. Next, the backrest height should support the lower and middle back. If possible, there should also be a slight curvature on the backrest at roughly the L4 to L5 lumbar region. This will help to maintain the lumbar lordosis, hence places the back in a more upright position automatically. There are also some other simple recommendations for people who sit for long periods of time. They are recommended to make frequent small adjustments to their sitting position to ensure that there is some movement in the back. And this also helps with shifting the disc pressures around, thus nourishing the discs. Also, they should not sit for more than 1.5 hours at any one time. Do encourage them to stand up and move around for a few minutes before sitting down again. And do that frequently throughout the day. Due to the increased number of people sitting for long periods of time for their work, make sure that their workstation is customized to suit them is of critical importance. Such ergonomic customization should take into account the following factors: the task that a person engages in, the user themselves, for example their body type and characteristics, the seating that is available at the workplace, the type of work surface, and the arrangement of the workstation, for example, where is the computer screen located. Here are some recommendations for a good workstation arrangement to prevent work-related injuries. So now, pause this video and have a look at the details of the recommendations. So to summarize, we talked about some of the sitting postures and their biomechanical factors. We also looked at some principles behind what is considered good sitting positions. To help with maintaining a good sitting position, we also considered the proper use of a backrest. We also briefly looked at some guidelines for a good workstation arrangement. So I hope this video is helpful for you to think about what is considered good sitting postures. And I'll see you at my next video. Bye.